Hi everyone, Brett Laffin here, physical therapist and author at brettlaffinpt.com. I just wanted to take today to talk a little bit about something that I frequently comes up when I'm talking with patients and when I'm working with patients who are dealing with shoulder pain. And something that they always ask me, or a lot of times people will ask, you know, they'll come in and they have this pain in their shoulder, and obviously it's either from something like a surgery or it's just your standard kind of tendonitis kind of an issue. Regardless, what tends to happen is that these patients, they develop, they not only develop the pain in the shoulder, but they'll start feeling the pain in the elbow, they'll start feeling their pain down their hand, and they can kind of start to say, what's going on here? It gets almost a little bit scary, right? Because if you don't know what's happening, you can understand why they would be concerned that maybe something else further is going on. But what I do is I tend to take that as an opportunity to educate the patient, something that I love to do. But this is something that I love to talk about because it really is a unique type of a thing, and a really kind of, in my opinion, a kind of a cool explanation for why you tend to feel pain further down your arm when you have shoulder pain. Now, before I get into my explanation, I first want to say, obviously, there's a lot of different reasons why you can have shoulder pain, why you can have pain going down your arm, right? And, very often the pain is not coming from the shoulder. Even, you might feel it in the elbow. It's not coming from the shoulder. It could be coming from somewhere like the neck. It could even be coming from the wrist, something further down the arm. But honestly, that's where we come in. Us, medical doctors, physical therapists, we're the ones who can really give you a good screening and determine where your symptoms are likely to be coming from. So, obviously don't take this video as, reason to diagnose yourself. Always, seek a professional. That's always my main disclaimer, right? So, but with that being said, a lot of people, like I said, say you're coming in for your shoulder and you've got some issue going on in your shoulder, whatever that might be, but you start feeling pain, down in the elbow, the forearm, maybe even into the hand. There's a really kind of a cool explanation for why that is, and let me show you what that could be. So I'm going to show you this picture here. It's kind of a little bit of a strange one. Sometimes you may look at this and go like, well, he's lost his mind. What is he thinking of? But this is an actual representation of how your brain sees your body. Okay, it's the fancy word for this picture is called a homunculus, and basically what it is each part of the body is represented in the picture based on how much surface area or how much area in the brain is dedicated to either control of that body part or sensation of that body part. So for example, you can see that this person's mouth and the lips and the tongue are huge, right? The hands, look how big the hands are. What that suggests is, that says that in our brain, the mouth and the tongue and the hands has a huge surface area, a huge area of the brain which is responsible for controlling those body parts. And that makes sense because we speak very fluently and eloquently, right? And we have a lot of control with our mouths and our tongue. That's what makes us being able to communicate via speech, right? Our hands are very dexterous, right? So we can do very fine motor tasks, and we can feel. If I were to touch you on your fingertip, you'd likely be able to tell me exactly where I'm touching you, right? However, things like the knee, you can see, are very, very kind of small in their representation in the brain. But take note that the same goes for the shoulder, right? So the shoulder has a very small area of the brain that's actually dedicated to feeling what's going on in the shoulder. So what happens when you have pain in your shoulder, when you have some kind of an issue, whether it's after surgery or just like tendonitis or something along those lines, sometimes what happens is that the brain, when it's trying to tell you where your pain is, it actually kind of misses, and it doesn't tell you, it doesn't have a clear, very specific representation of it being in your shoulder. It kind of just knows it's like somewhere in here where you're having your pain. So you may actually feel it more in your elbow, more in your wrist, but the issue is really in here, right? And so what that shows you is that the reason why a lot of times you have pain in your arm when you have shoulder pain is because your brain is actually not being able to specify an exact location of where that pain is coming from. So it's something that at least has a background to it and a scientific rationale to it. And that's why I like sharing this with patients, because it is something that makes you feel like, well, at least I'm not going crazy, number one. And number two, there's a logical explanation for why I'm feeling what I'm feeling, right? So next time you have pain in your shoulder and you start feeling it more in your elbow, or you get this achy sensation down your arm, remember the homunculus, okay? Always come back to this. This is what your body looks like in your brain, and it's a great explanation for why you have pain, not so much specifically in your shoulder, but maybe all the way down your arm. All right. Now, stay tuned for more, more information, more tips and tricks, and all kinds of stuff as time goes on. I love doing these videos, so please continue to send questions my way. I'd love to answer anything I can for any of you. All right. Thanks for taking the time to watch, and I hope you have a great day. All right. Bye bye.